It has been an honor for me to be who I am at this point in my life because I've been able to do two things. One is that little baby right there. He's about 2 years old now. And then the second thing is to be a midwife. And I don't know how many of you know what a midwife is because I didn't know what a midwife was until I was probably 20 years old and I was in college. I thought that I was going to go to medical school and be an OBGYN or a family doctor or a pediatrician. I loved families. And there was something about what I wanted to bring to the world of healing that I wasn't getting in my medical training. And so I took a women's health course, and it was taught by a nurse midwife. And I was like, what is the midwife? What do you do? And I asked that question as a college student, and I still get questions to me about, what I do. And I mean, people think things like I'm a wet nurse. Like I just breastfeed other babies. That's what a midwife does. That's not what a midwife does. So, I decided to change my path from going into medicine to going into midwifery. And I was always really involved as a student in advocacy issues. I felt like I wanted to dedicate my life to empowering people. And so a mentor of mine had told me that I should really pursue getting my degree in public health. I knew I loved mothers and babies, and so I found one of the few programs in the country that had a maternal and child health degree in public health. And so I spent the couple years after I graduated my first degree in just understanding the context of maternity care and what birth looks like in our country and around the world. And so when we talk about a conversation about integrity at birth, let's start with where things are now. Specifically, the U.S. landscape. This was done by the Commonwealth Foundation back in 2010, and they ranked the top 7 industrialized nations on different elements about their healthcare system, like effective care, safe care, patient-centered care, equity, efficiency. And as you can see, the United States ranks last in almost every single category. You can't see it that well, but at the bottom line is how much we actually spend on our healthcare systems, and we spend the most. We spend more than double than any other country in the world. That's 16.2% of our GDP, $2.2 trillion, that's not a small amount. $125 billion is spent specifically on the care of mothers and babies. So the top 2 conditions that are billed to private insurance and Medicaid is maternity care and newborn care. So if you spend a lot of money on something, you expect that you would have something really great. A great car, a great home, a great meal, a great education. What are we getting for all the money we're spending on maternity care? This is a ranking of infant mortality. This is the number of children that are dying by their first birthday. And since the 1960s, we've actually dropped. So we spend the most, and we're way down at the bottom of that list. Georgia specifically. How many of you are from Georgia? Just by a show of hands. Okay. I was born and raised in Michigan, so I found myself, oh yeah, go blue maybe? Yeah, no. It's okay. But I found my way to this state, and I feel like I was meant to be here right now. Because some of these statistics that I'm going to talk about throughout this presentation about this specific state gives me chills, to be honest with you. So we have one of the highest percentage of low birth weight babies. We have one of the highest infant mortality rates for our nation. The March of Dimes ranks Georgia as a D, which is actually better from when they started the report cards because we were at an F. And while countries around the world are fighting to reduce the number of women that die in childbirth or for pregnancy-related causes, the number in the United States is rising. So back in 1990, the world kind of came together and said, we have a woman that dies every minute of every day from birth or pregnancy-related causes. One woman every minute of every day. And so there was a lot of effort put into uplifting communities and figuring out what it was that communities needed to support women and to support families at the beginning of life. And we've brought that number down around the world by half. So now it's 1 woman every 2 minutes. There's still a long way to go, but in the United States, that number is rising. And in Georgia, we have the highest maternal mortality. And I share this with you because I don't think a lot of people know the state of maternity care in this country. I didn't know, and I'm a midwife, and I've been a midwife for 8 years, and I've surrounded myself with research and advocacy and being at the side of the women that I'm caring for, and I did not realize, I knew we were low, I didn't realize we were last. Right now, 1 in 3 babies are born via cesarean section. So 33% of babies are born through the mother's abdomen surgically, rather than born vaginally. The World Health Organization has said that, we know that we need to have cesarean section because it does save lives. It saves the lives of children, it saves the lives of mothers. But 1 in 3 is way too much. The number that we should really be at is between 5 and 15%. So we're double that. And the thing is that we haven't improved our outcomes. So if we're doing more, shouldn't we be getting better outcomes? We're not. We're actually getting worse outcomes. The number of inductions in the United States has doubled since 1990. And there are huge racial disparities when it comes to childbirth. For example, Black women in the United States are nearly 4 times as likely as white women to die from pregnancy-related causes. Infants of Black mothers have a 13.5% chance of dying in the first year of life compared to 5.7% of infants. Shouldn't we be worried about this and trying to understand why this is the case? Because that's not equality. There's something going on. An estimate 1 million women each year will struggle with a perinatal mood or anxiety disorder. So when you think about birth and you think about becoming new parents, a lot of people think about, sleepless nights, but also about joy and celebration. And sometimes it's a really difficult time. Sometimes you never get out of that really difficult time. And if 1 million women, and this is just women, what about men? We're seeing higher and higher rates of postpartum depression and anxiety in partners. Breastfeeding. At 1 week of life, less than 50% of babies are breastfed. At 3 months, 2/3 of babies aren't breastfed anymore. I have this list here, and I'm going to go through it because this is a list, actually, if you look at the number of procedures that are billed most commonly when you get to that 125 billion number I was talking about, most of those procedures are on this list. So I named them overused interventions because evidence actually doesn't even support the use of them. So continuous fetal monitoring, where a woman is in labor and she has 2 belts, one monitoring the baby's heart rate and the other monitoring the frequency and duration of her contractions. There's never been any research to show that it actually has benefits. It was introduced to hospitals by a sales company that said that it could prevent cerebral palsy, based on no research. Once it got introduced into the hospital system, it never went away. And so it has increased the risk of interventions and cesarean section, but it hasn't improved the health of mothers or babies. Artificial rupture of membranes, that's where someone goes in and actually tears this amniotic sac that the baby was in to help speed up labor. That's done routinely. It's like, did nature really not plan for that? I mean, the water will release on its own, and it doesn't have to release for a baby to be born. There's actually, it's known as a phenomenon called a birth in the caul, which is where a baby is born with its sac still intact. If you've never seen it before, look it up because it is a beautiful, beautiful thing. Babies that are born in the caul are said to be meant for great things. It's a very auspicious occurrence. Happens in about 1 in 40,000 births. I've seen 12. And that's not because I'm lucky or I'm special. I really don't think it is. I just don't interfere. I just let it happen. Early separation of mother and baby. Dr. Hickman, you started talking about abandonment. And there is a lot of people and theories and individuals who feel like the connections from their birth experience are with them for the rest of their lives, whether they even realize it or not. So why are we separating a mother and baby for no reason? If there is a reason, there's a reason. But the vast majority of time, there's not a reason. It's routine. It's just the way that you're taught. When I was taught to be a midwife, I was taught to just leave the cord pulsating, because then the nurses wouldn't be ready to whisk the baby away because it was still attached. It's like you can't do anything about it. Circumcision, inductions of labor for non-medical reasons. Now, this is a list much longer of evidence-based, underused interventions. So I'm just going to read through them briefly because they're awesome and you should know about them if you don't. Midwifery, water for labor and birth, group prenatal care, emotional support during labor, movement during labor, nutrition and fluids during labor. Who would have thought? A peaceful environment, listening to the baby with a stethoscope or a Doppler instead of those bands that have you hooked up into a machine the whole time so you can't really move around. Delayed and spontaneous pushing, not lying on your back for birth, chiropractic care, delayed cord clamping, early skin-to-skin contact, turning breech babies externally, vaginal breech birth, vaginal birth after cesarean, vaginal twin births. These should be safe options that women have, and they don't. So the Listening to Mothers survey wanted to really, it was a study done, now it's in its third iteration. I'm going to talk about the third iteration later in the presentation, but it wanted to capture what women's experience really was in birthing in the United States now. And so 83% of women had an IV, 76% had an epidural, 75% had more than one vaginal exam, almost half had their waters broken, almost half were given Pitocin to speed up their labor. Is it really true that 50% of women have bodies that don't know how to birth a baby? That's not what's going on. 41% started labor on their own. So we have more women that are induced into labor than go into labor on their own. There is a time and a need for inductions. Inductions do save lives. I've induced women for severe preeclampsia where they were literally on the edge of a hypertensive crisis. And that induction saved their life and their baby's life. But 5% used showers for labor coping. 15% ate during labor. 25% moved around after being admitted to the hospital. So 75% of women, once they get admitted in labor, they don't move from one position. Or if they do, then you have to kind of just shift and make sure that the monitor stays on, because that's what's the focus, is making sure you hear that beat every single second. But 83% of women feel that maternity care is good or excellent. So do we really have a problem? In actuality, only 2% of women receive evidence-based standards of care for normal birth. 2%. So there was a big report done called the Milbank Report that looks at transforming maternity care. And they used this term, the perinatal paradox, and it sat with me ever since I read it. And it's basically saying, you know, we're spending more, we're having more interventions, but yes, yet we're having more worse outcomes. So the point that I am in my life right now is, you know, sitting with this information, you know, knowing from a numbers and public health perspective kind of what the overall picture is. But I've spent the last years of my life with women during birth. And so I've learned a lot. And when I was thinking about integrity at birth, I really saw in front of me these things that I think can bring that integrity back to birth. It was 15 things. I'm going to go over them with you briefly. One is that we need more midwives. It's not that women don't want midwives, it's that we just don't have enough of them. Midwives attend about 7 to 10% of births in the United States. In most of those other countries at that first slide that I showed you, midwives attend 60 to 80% of those births. And the World Health Organization has also said that, midwives are really the most appropriate care provider for women, regardless of their risk. The second thing is that women and families need options of birth setting. 99% of all births in the United States occur in the hospital. That's not the case in other parts of the world. So that 1%, most of it is home birth, and then a quarter of it is in a birth center. What we don't have in the United States, unfortunately, but we're working on it, is an integrated system to connect all three of those settings. So if you choose to have birth at home, but end up needing a more acute level of care, you will have a seamless path to get that. What about honoring the universal right of childbearing women? Every woman has the right to information, informed consent, refusal, and respect for her choices and preferences. 4, we need to earn their trust. I've had so many women that tell me about how they felt they were betrayed by their provider and that they trusted their provider. And I think that as a provider, I feel like I need to earn the trust of the women and the families that I care for. That should be an expectation of all providers. 5, we have to understand that birth is as safe as life gets. Things happen. We can't control life. We can't control birth, but we can have integrity at birth. 6, we need to respect women. Even just talking about language in birth, allowing women to do things or cutting women. This is the language that I hear as a midwife at hospitals when doctors are talking about taking a woman back for a C-section. Oh yeah, we're going to go ahead and cut her. I don't think that that's how we should be talking about birth or a woman's body. We should give them food and drink. We should tell them that they are strong. We should give privacy and not interfere. Michel Ledant, who's an OBGYN in France, transformed a whole hospital system and dramatically improved their outcomes. And the biggest things that he did was get rid of the machines and the people and just put a bed in a room, keep the lights low, and stay out of the room. Come in every now and then to listen to the baby. And birth happened. We need to get rid of the fear in birth. Google TED Talks by Anna Mae Gaskin. She has so many wonderful things to share about how we can get the fear out of birth. We need to focus on prenatal care. We need to bring families and communities together. We also need to openly recognize that part of integrity at birth is respect, vigilance, and grace for when things don't go right. It's never easy to lose a child. It's never easy to lose a parent. We need to have grace through all of that. And it can start with birth. We need to be curious. There are so many things about birth that we don't know. There are so many things about the effects of the environment prenatally on that person's life. Let's ask those questions. Let's come together. Let's eliminate violence and trauma at birth. Suzanne Arms, who's a friend of Life University, is a photojournalist she felt traumatized by her birth experience, and so she went into hospitals and she went into homes and just witnessed birth. And she ended up writing several books, the first of which was called Immaculate Deception. And she wrote this: if we hope to create a nonviolent world where respect and kindness replace fear and hatred, we must begin with how we treat each other at the beginning of life. For that is where our deepest patterns are set. From these roots grow fear and alienation, or love and trust. So this is what I see as integrity at birth. It's a beautiful thing. Why can't we all have that? I think we can. That's why Atlanta Birth Center is opening, because we believe that this kind of birth experience will change the world. Thank you.